I think you're absolutely right on that, and I think the Medicaid experience in the United States is very clear. That's what happens, because people with Medicaid do have coverage, they're insured, but it pays less than private coverage. And when these secret shopper studies, and it's not just the one David said, there's been several of them, they find over and over and over that if you call with the fancy private insurance, you get an appointment much sooner than if you have Medicaid. Even among doctors who will deny that they do this, right? Doctors say they take Medicaid, they say they're open to everyone, but you get your appointment faster. And you know, I'm not here to trash doctors. I am a doctor, I work with doctors, but this is human nature. If you're going to be paid twice as much to see Mrs. Jones as you are to see Mrs. Smith, you make time in your schedule for Mrs. Jones. Maybe you come in a little early, or you squeeze her in, and you're just a little less likely to do that for Mrs. Smith. And it translates into unequal care and actually very inefficient care, because the decision about whether to squeeze a patient in or not should be based on they really need to be squeezed in because they're sick, not because the patient has twice the reimbursement of anybody else. So you worsen the efficiency of the system from, just a point of view of population health. You end up with waste resources going the wrong place. And the administrative costs of charging people different amounts, actually that's a different type of inefficiency that you introduce.